now by the Health Minister, Karin Smyth. Hi, it's good to see you. Thanks for joining us. Talk to me about AI, it's World Cancer Day, AI helping with cancer research.
Well, it's a really exciting development, I think, because we talk about AI in the abstract often, don't we? But this is a really practical application that's going to help hundreds of thousands of women. So women will go for their breast cancer screening as normal, and then rather than two radiologists looking at the results of this, we'll be able to use AI to interpret some of those results with women taking part in a very large clinical trial. So we hope that that will result in faster diagnosis and hence faster treatment using those radiologists more specially focused on where we need them.
How do people get involved in the trial?
So it's run by what's called the National Institute for Health Research. They run lots of clinical trials. So we're very good at running clinical trials in this country. So women will be asked when they go for their screening if they are happy to be part of this clinical trial. And we very much hope that they will.
I'm sure they will.
Yes.
How long will it take? Before the results you have, and then you can decide.
Yeah, so trials do take a while. You start recruiting people. So very much grateful for the publicity to encourage women when they come forward. So if more women come forward more quickly, we'll be able to recruit them onto it and get through the right numbers. But the scientific experts have to have the right numbers, do the right analysis over time. So the more we can get on over the next year or so, the more quickly we'll be able to make sure that this does work well, to make sure that the results are proper so we can assure women that it's safe and proper to use AI technology. And also we'll be able to look at how that's working to use AI as we're using it in other sorts of areas as well. So learning as we go.
When do you think, it will become routine for AI to be used to look at breast screening?
Well, I think we have to see how it works. That's the point of a trial, to make sure that everything is safe about it, that the technology is doing what we think it does do. So it's hard to put an actual physical date on it when it will become the norm, but this is a very large trial. We screen about 2 million women a year at the moment, so 700,000 women coming forward will take a year or so at least to be able to get that through and get the results done.
Yeah, and I'm sure you would urge all women watching this morning to take part. I have to ask you about Sky News' investigation that Becky has done that found that care home patients with maggots in a wound, unexplained bruises and a lack of hygiene. How can that happen?
I haven't heard that, but that is truly shocking.
We can show you the report.
And obviously, if that's a published report, then obviously we will look at that. That is a shocking level of something to be found that nobody should have to go through.
Yeah, literally maggots in a wound. And when we asked the care home involved, they said that sometimes when it's hot, maggots can be found on their patients.
I can't answer that question, and obviously...
Okay, what you could do for us then is look at Becky's report, because it is online and you can see it, or we can show it to you before you leave the building, and then perhaps you could give us your reaction.
I'm sure that colleagues would be very content to give a reaction to any report that comes forward to the department.
Can we ask you to look at it, Minister?
It's not my area directly on social care, but obviously the department will
because it's outrageous, isn't it? Absolutely outrageous. Something you will know about is the NHS refusing to publish in full the report into the Nottingham killings, where a schizophrenic murdered 2 students and a caretaker. Reporting a summary, but not in full. Why?
So, I mean, this is such a tragic case for those families in Nottingham. My understanding is the report is shared a part of that is shared with the family, in discussions with the family.
But the family want it to be published in full.
And I think that would need to be discussed directly with the NHS in the usual way.
Yeah, but you're a health minister. Why do you think it shouldn't be published in full?
There may be reasons why that things
well, the suggestion is to protect his privacy, but surely he relinquished all right to privacy when he brutally murdered Barnaby Webster, Grace O'Malley, Kumar and Ian Coates.
I think we have to think about the victims and supporting the family in this, and if there are lessons to be learned, or that there are ways in which reports need to be published differently, then obviously I think that does need to be looked at. My understanding is that where some reports are shared, that there might be not just on the perpetrator, but there may be other parts of that report that are private. I don't know directly, because I've not seen that report either.
OK, well, the family of Valdo Calacane released his medical records as part of a Panorama documentary last year. So it can't be said that it's in the public interest not to, or his privacy, not to release the report in full, because we've already
got his. Yeah. No, I understand that. I understand that argument. I don't know any more details about.
Do you think
why
it should
that
be looked
might
at
be.
again?
Well, I think all of these things should be looked at and learnt from in time. And I think the families here have, and families shouldn't have to work that hard to get the sort of justice that they need. That we should always learn from that. And if there are reasons that things are kept private and that's not a good reason, then we should always look at that, because I do think transparency for families and the wider system is really important.
And the families have spoken to the Times newspaper this morning, and they have said that they feel it's in the public interest for this report to be released. If that's what they're saying, then surely we should be looking at it.
Well, I think that's the conversation that absolutely should need to happen.
I want to ask you about council tax before I let you go. You'll have seen that some councils are being given an opportunity to increase their council tax by more than what they normally would be. I think it's 5%, I think, isn't it, the limits at the moment? But they want to increase it further. Windsor, Maidenhead, Birmingham, Bradford, Newham, Somerset, Trafford, the list goes on. Some of them want to increase it by up to 9%. Is that fair for people who live in those boroughs?
Well, I think it's, you know, the state of councils, as much of the public sector that we inherited in July, is dire. They are really struggling. They're struggling across the entire country. So my understanding is that in looking at that, some places are struggling more than others. I mean, there's a mix there of Conservative and Labour councils. So
there is,
and rural,
but you're the government,
and
you can decide whether or not they can increase it by that amount.
So my understanding is that many more councils have come forward to ask for that increase, and that the department has said no to that. They're scrutinising that very closely, because we don't want to see taxes increase in people in those areas. But those areas are particularly desperate and need that in order to keep basic services running. It's a really dire state that local government has been left in.
Yeah, but you're not going to fix it with just one increase, are you, above what the cap is? So I'm guessing if you agree this time, then you'll have to agree next year and the year after and the year after that.
Well, we've, you know, given money to councils for some of those basic services. Some councils don't need to raise the cap, so we need to learn from what those councils have been able to do with in the same conditions that these other councils have not been able to do. And that's the work of the government, really scrutinising the state of those individual councils to make sure that they are using every penny of taxpayers' money properly, because not everybody has had to do that, and that's the difficulty. That decisions have to be made in order to not have collapsing services in those areas. This measure, which I would hope would be short term, happens in these areas, but it's not happening everywhere, so we need to learn from other places.
I'm just going to have to come back to my question about Becky's report. I know you say that you've not been made aware of it, but I am being told in my ear by my producer that the details of it were sent to your team yesterday.
Well, I'm sorry to hear that, if that's the case. As I said, any report that shows bad practice or appalling treatment in any of our care or health services would be looked at by the team, and we'll make sure that someone gets back to you.
And only 3% of complaints were actually investigated?
In this particular care home?
Oh, no, generally, when complaints are made about care homes, only 3% are investigated.
I can't answer that, and particularly what sort of complaints we're talking about or the process for that, but I'll make sure that somebody does come back to you.
3% out of 70,000 concerns raised. I think you're going to have to chat to your team, aren't you?
Well, people need assurance when they have their loved ones in care homes that they are being looked after properly, of course. We know there are a number of problems.
That doesn't sound
we know there are a number of problems with CQC. That's well documented, and needing to look at how they are doing things in the future much more carefully. If that's the issue here, I'm hearing this cold. You appreciate. So,
I do. But you also appreciate that we did tell your team yesterday, so that you would be prepared for this conversation this morning.
Well, obviously, I'm not the happy person that's not knowing that, but we do need to make sure that people are assured of their care in their care homes. That is a really important thing to do.
We'll leave it to you.
Thank you.
Thanks very much.